Okay, now we're on to week 4, manuscript writing. Has it really been 4 weeks since you started? Maybe not. Okay, that's fine. So we're going to talk in the introduction section about the main types of manuscript writing work, what it is, a brief scope of that type of writing, and then we'll dive down into some of the specifics, creating an outline, annotations, using images and tables in manuscripts, manuscript references, handling revisions and comments, and then questions to ask clients when you get a project. And then if you're signed up for the paid version of the course, you'll have a feedback test to do for this. So, just a quick review of the scope of manuscript writing. As far as I can tell, I've never seen it written down anywhere, but there's like two basic branches of manuscript writing. The first is to do with continuing medical education, education materials, and for that, you would want to check out acehp.org, the Alliance for Continuing Education in the Health Professions. As I've mentioned before, this is a very good organization to join and participate in if you're interested in medical education. It's where a lot of our clients belong to. So, as we're a group of freelance medical writers, you're going to be a freelance medical writer. You should check out that organization, which is full of your potential clients if you're going to do CME writing. And then publications planning, and I know less about that organization and that world. That's International Society for Medical Publication Professionals. There is a certification that you can get, which is Certified Medical Publication Professional. I'm actually having an interview with Dr. Lisa Baker, CMPP, this afternoon. We're going to edit that and put that where these materials are so you can listen to that. I'm sure that will give a lot of great insights into that CMPP and whether you should consider getting that for yourself. And then another source of medical manuscripts is academic institutions and medical associations. One of our clients is a regional anesthesia client, and we do like their guidelines and things like that. So that's a bit of editing and some writing. And they can come from anywhere. And then we've also done work over the years for academic institutions that have their own departments and require assistance with writing manuscripts. And then individual MDs and PhDs will occasionally reach out for assistance. And, that you should take those on a case by case basis. I would definitely have some form of payment upfront, just saying, because it can be, they're not supported by an institution when you give them the bill for, $2,000. And if there's any problem at all, that they debate what you've written, there can be sometimes a problem with that. So just be really careful when you're working with individual MDs and PhDs who will occasionally reach out to you for your assistance. Typical fees for manuscript writing will be $1 per word or more, and then 100 to 150 an hour is usually in the range of what they a client would expect to pay. Annotations takes more time. Annotations take a lot more time than if it's not annotated, so keep that in mind. And then multiple expert reviewers can take more time if there's a lot of back and forth. And then also, if they already have an outline written, that cuts out some of the time. But if you have to write an outline, then that will take more time. So all of these things you sort of have to know, but I'd say, for a 4,000 to 5,000 word manuscript, you should have at least 50 hours billed for that at your hourly rate. In general, a manuscript, if you've written one and you can provide a link to it to potential clients, it's an impressive sample. If that ends up, especially in a prestigious journal that everyone's heard of, your name should be included at the end of the paper as medical writing assistance provided by your name, but your name should not appear alongside the author's names up at the top there. So you should have that conversation with your client if there's any confusion over that. And just to be clear too, you're a writer. You're not a data analyst. You're not a statistician, a graphic designer. Your job is to convey the data or concepts that have already been thought out and to make the manuscript publication ready. Your job is not to take their data and make sense out of it. That's really actually their job. And you're just there to really just put the finishing touches and write up the manuscript and the data. So you just need to be extra clear about that sometimes. All right, so let's dive into the nitty-gritty of manuscript writing.